Hello and welcome to Health Professional Radio. I'm your host, Neil Howard. Thank you for joining us for another segment. Going to be speaking with Dr. Robert Vigersky. He's Chief Medical Officer at the Diabetes Group at Medtronic, and he's joining us here on Health Professional Radio today to talk about the evolution of the insulin pump, virtually training type 1 diabetics how to use an insulin pump, a recent FDA approval of the Minimed, and also Medtronic's recent acquisition of Companion Medical's Smart Insulin Pen. A lot to cover in a short period of time. Let's jump right in. Welcome to Health Professional Radio, Dr. Vigersky, and thank you for taking the time.
Well, thanks so much for asking me to spend some time with you, and I'm happy to be here and happy to answer any questions you might have about all those topics that you just listed.
Well, give our listeners a brief background. What's your area of expertise, and talk about your role briefly there at Medtronic.
Right. So I'm an adult endocrinologist. I've been with Medtronic for 5.5 years as the chief medical officer. And prior to that, I was at Walter Reed, which has been in the news lately quite a bit. I was on active duty in the military for 27 years, all of it spent at Walter Reed, where I did teaching and research on the use of technology to help patients with type 1 and type 2 diabetes. I was also president of the U.S. Endocrine Society, which is a professional organization of about 18,000 members. And that was about 10 years ago. I still see patients as a Red Cross volunteer at Walter Reed a few times a month, so I'm able to really relate to what's going on in the real world, as well as in my role at Medtronic, where I represent Medtronic in interviews like this, at congresses and medical meetings, help with our scientific program and design and execution of studies, and a whole host of other supportive functions to bring the best technologies to patients and people with diabetes.
The insulin pump, talk about how it's evolved. Obviously, there have been some great advances in the technology, some huge advances that we're going to talk about here momentarily. But let's talk about the insulin pump, what it's used for and how it's used.
Insulin pumps have actually been around for 30 or more years, and Minimed was one of the first, if not the first, to commercialize insulin pump therapy. But it's really been in the last 15 years that insulin pump therapy has made the kinds of advances that have made it an important therapeutic option for people with diabetes. And the reason it's made those advances is because it is now able to use data from continuous glucose monitoring, which can direct the insulin infusion into the subcutaneous tissue every 5 minutes. So insulin pumps now have gone from what I call dumb pumps more than 15 years ago to smarter and smarter pumps as we enter into the 2020s. So with the CGM data, the pump can deliver the amount of insulin to keep blood sugar in the target range as much as possible, and also at the same time avoid hypoglycemia so that the person with diabetes is safe and yet achieving very good glycemic control.
Now, obviously, a patient utilizing an insulin pump must be intimately aware of its functioning, maintenance, that sort of thing. During the pandemic, pretty much everything shut down as far as hands-on training, teaching someone how to use a pump. Has training people to use insulin pumps been affected just like everything else when it comes to remote learning or training?
It has been affected, but actually not in a bad way. So around mid-March, Medtronic, like other organizations and companies, pivoted almost immediately to doing everything virtually. So our intercompany meetings are all virtual. The representatives going around to the various physicians' offices were doing this virtually, and we pivoted to training virtually. And the training for our latest iteration of pumps is extensive and takes several hours. But what we did was we looked at this, we took the curriculum and applied it to doing this virtually. So when this began, I actually thought this was a great opportunity to understand whether or not this was better, worse, or the same as it was if you did it face-to-face. So we've actually done a study, and this was published last month in Diabetes Technology and Therapeutics, that compared 1 month prior to the pandemic shutdown, so in January to February, to 1 month during the shutdown in March through April, end of March through end of April. And we looked at a number of metrics in terms of process and efficacy of the education, and also the outcomes in terms of the glycemic control of the people who were trained pre-pandemic and during the pandemic. And I think it's, in a sentence, the summary of it is, it's at least as good and perhaps better. And we think that patients who had underwent this training were actually more appreciative of the fact that they didn't have to get on the road and drive to an office, didn't have to look for parking, didn't have to wait in the waiting room. They could schedule the training at their leisure when they actually had time to do it, not when the trainer or the physician had the time. So there were was a lot of positive feedback. In fact, we used something called the Net Promoter Score, which is a measure of patient satisfaction, and it was already very high, but it increased even further. So from the person with diabetes standpoint, this was actually a better experience, and the glycemic control was about the same. So we think this was a win for everyone.
Now, the recent FDA approval of the Minimed 770G insulin pump system, it has smartphone connectivity. Talk about this approval and why it's important.
Yeah, this is an important next step for the use of insulin pump therapy, because the ability to use Bluetooth connectivity to a phone, and then the ability of that data to be looked at by the person using the device, but also by up to 5 caregivers, is really an important feature, particularly for children. So the approval that we got from the FDA was for ages down to age 2, which particularly in the younger children, parents really want to know what's going on with their child's glucose control. They're off at school, they're off playing at friends, they're at overnights, and this allows the parent to keep track of both the insulin delivery and the glucose levels, as well as get real-time alerts about if they're tending towards hypoglycemia or hyperglycemia. So it's an important comfort feature for the caregivers. And the other feature is that now all this data that gets uploaded to the cloud can be viewed by the healthcare provider at any time. So instead of having to come into the office to download the data, which is generally done every few months, the individual's data can be seen at any time by the healthcare provider. And in fact, during this COVID pandemic, this has been a major advantage, because the data that can inform the physician about how the patient's doing and what management changes are appropriate can be made virtually rather than having to have the patient come into the office.
Let's talk about your recent acquisition of Companion Medical's Smart Insulin Pen.
Right. So this is a very important acquisition for Medtronic, because it allows us to extend our ability to help people with diabetes to where they are in their journey with diabetes. Many patients don't want to wear an insulin pump, and they've been taking insulin injections for years, and they're very happy with that. But our ability to have a smart pen, which can tell them and their physician when they actually took the insulin and how much insulin they took, and merging that with the continuous glucose monitoring data, is really a boon for the ability of both the person with diabetes and their healthcare provider to better manage their diabetes.
Where can our listeners go online and get some more information about Medtronic and your recent acquisitions and any other information that we'd like to find?
Yeah, I would ask your listeners, if they want more information, to look at MedtronicDiabetes.com. That will give them all the information they need.
Well, I thank you so much for that information, and I appreciate you joining us here on the program this morning.
Well, thanks very much for giving me the opportunity.
You've been listening to Health Professional Radio. I'm your host, Neil Howard. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes, listen in, download at SoundCloud, and be sure and subscribe to our YouTube channel at youtube.com, Health Professional Radio.